Hi, everybody. My name is Jarrett Wurst. I'm with Americord Registry, and this is...
Hi, I'm Lindsay. I'm also with Americord Registry.
Thank you for being here. We love working with the Prego Expo and want to talk to you today about cord blood stem cells and what makes Americord really, really unique. So we're here to ask you, answer any of your questions that you have. We're going to go through some frequently asked questions that we're hearing a lot throughout the trade show. So thank you for being super engaged with us. And we've had a lot of great conversations through the tool here. And after this portion, we're only on for 20 minutes, and there's so much we could talk about when it comes to cord blood and when we talk about Americord that we encourage you. We'll go live into our booth right after this. So we encourage you to take the conversation into that next level for sure. So we're here to help you. And really the goal for, I think, every pregnant mom is to make an informed decision. I think that's the most important thing that any mom or any family can make when it comes to the cord blood. So a lot of times we hear from moms on their second child who are so happy they at least looked into it a little bit later, and they never even were told to look into it originally from their doctor. They didn't know anyone that did it. They sort of heard about cord blood bank and they just never really made that decision. And then they look into it for a subsequent child and they really regret that they didn't make an informed decision the first time. So whether this is your first child or a second one, don't have regrets if you didn't do it for your first child. Of the cord blood that you do collect has a really good chance for it to being a match for a sibling of the child you're about to have. So congratulations on your pregnancy and congratulations for coming in here and trying to make an informed decision on cord blood. So let's just talk real quick on a cord blood and is it safe for the baby? A lot of people think that could the baby be injured or affected of any kind during the collection of the cord blood. So maybe Lindsay, you want to talk about that? And
yeah. So the process of collecting cord blood happens after the baby's birth. So during the process of birth, the umbilical cord is obviously where the blood is stored. So the cord blood that's stored within a needle is used to extract that for collection. And then, of course, it is stem cell rich. So the cord blood, as well as the tissue of the cord itself, can also be collected, and baby doesn't feel a thing. This is all done post birth, and usually done after the clamp has already been clamped. So the cord blood, as well as the cord tissue and the placenta, you don't feel a thing, baby doesn't feel a thing, and 100% safe for both mom and baby.
Yeah, and the one thing is if you choose to collect the cord blood, make sure you tell your doctor to collect as much cord blood as possible. So some doctors are in a rush and they don't collect as much blood as some other doctors who really know and understand that the more blood that is collected, the more chance you'll have, more cells. So just remember that if you decide to collect the cord blood and bring that into your labor and delivery floor. We'll talk a little bit about that process as well. The next question we'll talk a little bit about is what makes Americord unique. And I'll just start off by saying I'm super proud to work for this organization. I've been in women's health on the commercial side of women's health for over 15 years. And I could tell you that Americord is super obsessed with the customer experience and making sure we put out the highest quality product and service that exists in the industry. So without going too into detail about the process, we could do that. You could either call our 1-800 number or go to our booth after this, but we use the Rubenstein method of processing, which is a manual processing system. There's some companies that treat every sample unique by using an automated system, where they're treating every unique sample that has different sizes and different milliliters the same with an automated process. So we treat each one unique and different, and we literally walk through every single sample we have. We have somebody literally walk through the whole processing. It takes about 40 minutes to an hour. So with us, I sort of look at us as like the premium service in the industry. We don't cut corners in any way, shape, or form. There's a lot of companies who are, really big at marketing cord blood. They're, publicly traded and have to be beholden to shareholders, or they're owned by a private investment group. what I could say is that we are owned and operated privately, and everything that we do from processing to storage is of the highest quality and highest commitment to you, the consumer. And that is really the whole paramount of our company is we live and breathe for our customers. 1-800 number is available 24/7. If you happen to call and you're on the West Coast at 11 p.m., there's a good chance that somebody East Coast time, we're headquartered in New York City, our lab's in North Jersey. But we, there's a good chance someone's going to pick up that phone for sure. 24/7, just super obsessed. I just look at us as like, we don't want to be the biggest company in the industry. We are one of the fastest growing companies in America. We're on the Inc. 5000 list. And we just take super pride in our customer and your experience and making sure the whole processing for your cord blood, cord tissue, and if you decide to do placenta, is of the highest quality. So I just look at us like we don't want to be the GM or the Ford and make the most cars. We just sort of want to be like that Ferrari and high-end, Mercedes, where we don't need everyone to get it. And we put out such a high-quality product, but because we don't spend on marketing, we refer, a lot of referrals. We have our business, marketing that's where we get a lot of our clients is referral based. So we don't spend as much on marketing as many other companies. And it's really based on just referral business, some consumer marketing, but it's really just trying to put out the highest quality product. I hope that spells out a little bit of how we're different. And Lindsay, feel free to add anything else.
So, we talk about the processing being unique for us and highest quality. That goes for every ingredient that's used during the process as well. So certain ingredients are used as cryopreservatives, cryoprotectants during storage. We do use the highest quality of cryoprotectants as well. In addition to what goes into the cord blood collection bag to help, it's an anticoagulant. It's also the highest quality of anticoagulant on the market as well. So every part of the collection process, leading up to the process with customer service, we do hold ourselves in very high regard when it comes to service and quality. So I would 100% agree that sets us apart from other companies that are out there.
That's awesome. We're having a lot of questions. We're probably going to have to go into the booth after. And a lot of the questions that you're asking is on this slide that we're going to cover as well. But we're more than happy to go through, answer all your questions for sure. The one part is, where's your lab located, and what happens if there's a hurricane or power is lost. And real simply, we, have been around for more than 12 years, really 13 years. We were, Hurricane Sandy in the Northeast hit the area pretty hard. We did not skip a beat. We do have backup generators to the backup generators. And should we even lose power for an extensive period of time, we have enough liquid nitrogen and generators to last multiple weeks. And again, we went through the most horrific natural disaster, hurricane in some time with Hurricane Sandy, and we did not skip a beat. And so I just wanted to let you know how important the lab is in an area where there's really no earthquakes or excessive heat or a place that does get a lot of hurricanes. So just wanted to throw that out there. Lindsay, what do you want to talk about next?
Well, I can even follow up to the lab location. So as Jarrett mentioned, it is a geographical safe zone. So you really don't have as many natural disasters to be concerned about. But there's also 24-hour security that operates. So, for someone to feel the need to try to get into the building, there is security for that, as well as concrete blocks. So if there were to ever be excessive rains or flooding, your samples would not be affected by that either. So a lot of people like that about the lab, is that it's located in that geographical safe zone, because not every company has a lab that has that opportunity. So we are very proud of that as well. And then Jarrett, the next question is, tell me about cord blood stem cells and how many years will the cells be viable?
Okay, so that's a great question. So, and I just saw a question on the right-hand side that says, what cancers or what does cord blood treat as well? So we do have a proprietary cord blood 2.0 system. Cord blood, over 100,000 families are choosing to bank cord blood today. And a lot of families choose to bank it for many different reasons. So currently today, if you think about the first transplant that ever was done using cord blood stem cells was in the late 1980s. So it was one patient, one disease. And if you fast forward to 2020, there's over 80 FDA approved blood cancers, blood disorders, metabolic disorders, autoimmune disorders that cord blood does treat. So it's being used literally, cord blood is being used somewhere every single day around the world. Now, the reason why a lot of families choose to bank it for themselves is that it's an exact match for that child. And any sibling born to that child, there's a 50 to 75% chance that it will match that child as well. So a lot of families are choosing to bank because, God forbid, hopefully you never need it for that kind of disease or cancer. But if you do, you have an exact match. You have them at your disposal. You don't have to access the public banks and hopefully find a match. And related cells have a lot more significance and benefits versus unrelated cells. So just less graft versus host disease, higher just outcomes when it comes to related cells versus unrelated cells. So a lot of people choose to bank because of today and for that insurance, but also people are banking for the future. If you go on the FDA's clinicaltrials.org and you type in cord blood or cord tissue or placental cells, you're going to see a slew, dozens upon dozens of different trials that are being conducted throughout the world, and especially in the US with different institutions and research facilities. So a lot of people are choosing to bank for today and also for the regenerative properties for tomorrow. So I hope that answers that question. What's the other part of that, Lindsay?
How many years will the cells be viable, which you kind of touched on for the future as well.
Let me talk a little bit about that then too. So most families, when they bank the cord blood, they elect to choose 20-year options. So a lot of companies offer, 20 years, you could pay it annually at a charge that's around like $180, $175 a year. And then some people, we offer that as well. When a lot of people choose to just pay a discount and pay off the 20 years, so they don't have to worry about it going on. You get a steep discount for that. But experts do believe that the cord blood will be able to be used decades or even a lifetime. So 70 years, 60 years, experts do believe there's no degradation to the cells. They've actually thawed out cells that were 10 years old, 15 years old, 20 years old after being cryopreserved. And there's no degradation of the cells. They're stored in negative 196 degrees, and there's no degradation over time. So experts do believe they can last lifetimes and even possibly generations. So I hope that answers that question.
Yep. When the next question is, when do I need to make a decision to bank my child's cord blood?
What do you tell people, Lindsay, about when they should bank it?
I think most parents make the decision and actually do the enrollment process around the 24 to 28 week mark. But really, as long as a lot of you in here are first time moms, and some of you have multiple children, but you're probably doing the research. I've heard answers from moms being in here that their babies are due next month, some due January, February. So really anytime, if you're taking the time now to get the education and the information, that's a great decision. But you really do have until the last possible minute, but when you're making the decision, you want to have a kit in hand when you go to the hospital. So you probably want to make it closer to that 24 to 28 mark in advance with enrollment.
Yeah, that's a good point. We get calls all the time for people that wind up going into labor early. Mm-hmm. So maybe they're at 35 weeks, 36 weeks, and been meaning to call us. And then all of a sudden, next thing you know, I'm on my way to the hospital. So Americord, literally, we have a one price for everybody in terms of what you're going to do, and you get a white glove service. So some other companies offer different type of process, and you have to choose which you want or choose which courier you want to go with. You want to go with the medical courier, you want to go with FedEx, and there's all these options. We literally have a white glove service all across our system. So even if you go last minute, we don't charge you more. We will get the kit to you. If we have to hire an Uber out of one of our locations somewhere around the country, we're going to get you with that kit. even it's at the hospital, we do recommend that we don't do that, and we're more planned out. But most people, yeah, as Lindsay's right, is 24, 28 weeks. It's hard to start getting educated with cord blood right in the beginning of your pregnancy. You're more focused on your appointments and the health of the child, and then worrying about the crib and the strollers and all those, great things. So getting educated at 18 weeks, 19 weeks around your anatomy scans, glucose testing time, and then calling up and making an informed decision is the perfect time. And we will get you the kit. You just bring it in. Let's talk a little bit about the process too, Lindsay.
Yeah, that goes right into it.
So it's really easy. You want to go through it, or you want me to? Doesn't matter.
Sure. So it kind of ties the last question and this question in together. Once you make the decision to bank the child's cord blood, then you would actually enroll in the program. Americord would send you a kit. And actually, this is what the kit looks like. I have them stacked right here. So you'll receive the kit in the mail. It has everything you need, whatever you decide to do, whether you decide to bank the baby's cord blood, cord tissue, placenta tissue, all three, a combination of the three. Everything is in the kit that you could possibly need. So let's say you've chosen to, 100% certain you're going to bank the child's cord blood, but you decide when you have the baby, we want to go ahead and we want to bank the tissue as well as the placenta. Everything's in here. So if you make that decision very last minute, you have all the tools that you could possibly need for it. So the doctors, the nurses, the hospital staff have done these types of procedures quite consistently. So they're going to know everything in here is very self-explanatory for them. They're going to know how to do the collection. They're going to know how to package it. All the directions are also in there should they have additional questions. But after baby's born, usually parents will, within the first 24 hours of baby's birth, they'll call the courier to have this picked up. Typically the hospital staff will, if dad needs something to do right after baby's born, it'll be his job to call the 800 number, or a family member or anyone that's there with you. They can do that. And then the courier will come pick up the kit, and it will be within 24 hours back to our lab for processing.
That's awesome. And Diane asked a question while we're talking about the processing, and I think it's important. I know we're running out of time already. We only have like 4 more minutes. And again, come to our booth at Americord right here, and we'll be on right after this segment. We'll answer more of your questions. But that's a good question that Diane brings up, is I've heard stories about doctors just having issues and not communicating to patients. So I talked about it in the beginning, just make an informed decision. And I think it's really the most important thing for you to do is, while you're pregnant, look into cord blood banking, and don't depend on a doctor's opinion, your friend's opinion. It's great to get their opinion, but make the decision on your own. And I could tell you, because you might talk to a doctor who's so pro stem cells, and they're going to tell you to do it. And that's cool. We like that, obviously. But in a lot of times, the doctors don't even understand the cost to it, and they think it's really expensive, which it's not. I think that's another big myth with cord blood. And they might tell you, nah, it's not worth it, because they're worried about the cost. And they might think, they might prejudge and say, I don't know if you can afford it, and I don't want to tell you to do it. And then there could be some doctors who just aren't educated and don't really know about cord blood stem cells and what they're really being used for today and what the research is. So I would say the most important thing out of this whole session is make an informed decision for you and your family, and really look into your options for sure. It is really not that expensive. We have coupon codes. Use Lindsay's name. My name's Jared. Call 1-800 number for Americord. Tell them you met us at the Prego Expo. We're a small company. They know that we're here. We're going to help you out. But for the most part, there's a lot of value that these cells have. And for the most part, if you just want to do cord blood and pay storage annually, it's really, $1,300-ish. It's not that expensive. It's when people, want to start buying multiple products and paying the storage up front where we discount even more. But we'll work with you in any way, shape, or form. If you see value in it, call Americord, and we will do whatever we can to make sure we have a payment plan that's really flexible and one that could be suitable for you and your family. So I know we're already at the 20-minute mark. It goes really, really fast. Mm-hmm. Thank you for your time. Yeah, and we hope to see you at our booth. Anything else, Lindsay?
I didn't see the question, but when you asked about the hospital and the communication part, if someone is concerned at all about the actual process of collection on the hospital level, if someone in the hospital, a nurse or a staff member, doesn't communicate exactly what's going on, I've spoken with a lot of hospital staff and nursing staff and physicians, and our kit is very self-explanatory. So as long as you're not in there taking stuff out of it before you get it to the hospital, it should have everything they would need. So the collections should give you as much blood and tissue as possible with what you're given here. So there shouldn't be any issues with any kind of either miscommunication or lack of collection for us as well. So
that's awesome. And labor and delivery floors, they're really familiar with cord blood banking, and most likely they've used our kit. And even during COVID, even though a lot of hospitals had a lot of restrictions on who could enter the room and the labor and delivery floor, we were actually able to make sure that our white glove courier service was able to meet with a significant other, a husband, or a family member to get the kit. So even COVID didn't stop families from banking. And really appreciate all your time. Please come visit us at our booth, and we'll answer any more of your questions that you have. And thank you for making an informed decision. It's truly important, and we hope to hear from you soon. Take care.
Thank you so much for joining. We'll see you in our booth.